A lot of times when people hear about shock therapy, also known as electroconvulsive therapy, also called ECTs, a lot of people will think of history and horror movies and scary television shows. Some of you guys may have even seen the movie One Flew Over the Cuckoo's Nest, or even the popular television show American Horror Story. Unfortunately, those television shows and movies portray an inaccurate picture of what ECTs really look like today. The images are scary, and that's not reality at all. This is what ECTs actually look like. Now, some of you guys may have depression. You've heard about depression, or you know someone that has depression. And although I'm not a doctor, I've suffered from depression for many, many years, since I was 12. And I have had 2 series of ECT treatments myself. So therefore, I feel like I am qualified to talk about this topic. Today I want to cover 3 things. I would like to talk about what ECTs are, why ECTs are given, and the risks of ECTs. So let's first go ahead and talk about what ECTs are and a little bit of history. ECT is a procedure where a patient will receive an electric stimulus that is given through electrodes that are placed on the patient's temples and their forehead. And that electric stimulus will produce a seizure, and that seizure is supposed to literally help dump the serotonin from our brain. And that serotonin is one of our feel-good chemicals. And the ECTs were developed back in the 1930s by an Italian neuroscientist by the name of Ugo Seraletti. And according to the Mayo Clinic, back then when they very first started ECTs, patients experienced really bad side effects. I'm talking broken bones, fractures, dislocated joints, and that's because they did not have the medication back then that we have available to us now. So now when patients want to get ECT treatments, they are given a muscle relaxant and they're put to sleep by an anesthesiologist for a short time. The treatment roughly takes about 10 minutes total. And the reason why they give that medication is to protect that patient from getting injured. A lot of times when you're having the seizure, your face will scrunch up, your jaw will clench, so the doctor will put a mouth guard in to prevent you from breaking your teeth or biting your tongue off. Some of you may not know, but according to Mental Health America, roughly 100,000 patients are treated with ECTs in the US every year. That's quite a big number, and I think that's more than what a lot of people would even guess. And of course, it's all over the world. So let's go ahead and talk about why they are used. ECTs are used to help patients who are severely suffering from many different types of depression, bipolar, mood disorders, schizophrenia. They're actually a last resort given. So when medications such as antidepressants, antipsychotics, mood stabilizers, and psychotherapy are no longer effective for a patient, a doctor will recommend ECTs. And ECTs are also given when somebody is extremely depressed and suicidal and they need immediate relief, like right now. They are an outpatient procedure. However, patients that are in the hospital, say in a psychiatric hospital, they can also get ECTs treatment as well if that's something that they want to do. Even though ECTs are painless, they do come with risks, just like everything else pretty much. Because of my own experience and my research on the Johns Hopkins website, we know that immediately following treatment, patients experience severe headache and body aches. Even though they got that muscle relaxant, they still have pain. So in the recovery room, the doctor will give them a pain medication such as hydrocodone to help with the discomfort. and they will also send the patient home with hydrocodone, just in case that pain continues on later on the day or even the next day. And in my experience, it did. It was painful. Patients also experience confusion and memory loss. They will tend to repeat themselves over and over again because they forgot what they talked about like 30 minutes earlier. However, some people can experience long-term. Unfortunately, I experienced both, and I haven't regained a lot of my long-term memory back. A very rare side effect is there's medical complications that are associated with it. So even though it is extremely rare, it's still a risk. ECTs can cause problems with the patient's heart rate and their blood pressure, which can cause heart problems. But again, that is extremely rare, and you got to kind of weigh the risks and the benefits. So it is time for me to wrap up my speech. We have discussed what ECTs are. We have talked about why they are used, and we've talked about the risks. When medication and psychotherapy is no longer effective, there is still hope for people who have depression or any other mental illness, and that hope really is electroconvulsive therapy. With everything that you guys have hopefully learned today, is that if you're struggling, that you can reach out for help. And if you are interested in finding out where ECTs are available in your area and you want to look at getting ECT treatments, you can follow that link and it will show you where it's available in your area. Thanks for listening. Does anybody have any questions? Yes.
For a patient being treated with ECT, do they continue on their antidepressant?
Yes, it's extremely important that they continue, and would absolutely not recommend stopping. A physician is going to tell them you need to continue because it's not a quick fix and it's not a permanent fix. So that's a good question.
You had mentioned being treated twice. How long does the treatment last? I mean, like how much benefit time do you get from a treatment?
It really depends on the patient. Some patients need each ECT they call them series, and they're roughly 8 to 12 actual treatments during that series. Mm-hmm. Some patients only need maybe half a series. Some patients will need multiple series, like I had 2, or some patients have to have them for the rest of their life, and that's tough because medical expenses, it adds up, but sometimes people need to do that in order to maintain and live and be able to live a good, happy life. So, yeah, good question. Yeah.
So, I was just wondering, has there been any research study on, since there are effects on the brain after ECTs, have they done any studies on like addiction issues post ECTs?
I don't know about that. I will tell you from my own experience, and I've talked about this with my family, is it can be addicting. Mm-hmm. Because when you are going through the treatments initially, especially when you very first start, you don't really have very many emotions, feelings. So not only are you not feeling sad, but you're also not like extremely happy either. You're just monotone.
Okay.
But the more that you do it and using your medications and still doing psychotherapy, meeting with your counselors, still meeting with your doctors, you can stop. So, yeah. Any other questions? No? Okay. Thank you, you guys. I appreciate it.